Researchers say an opioid epidemic has reached Australia, with 1.9 million people beginning to take the prescription drug each year. 50,000 of those become long-term users, according to research conducted by Monash University's Centre for Medicine Use and Safety. Samantha Lalich is an Austin health pharmacist and PhD candidate for the Centre for Medicine Use and Safety, and she joins me now from Melbourne. Now, this research has been published today. What did you look at and what did you find?
I have looked at the Pharmaceutical Benefits Scheme dispensing data, and what we found was that, as you said, 1.9 million Australian adults initiate opioids or start to take opioids each year. We also found that 3 million people are using opioids each year. So where this is an issue is that traditionally opioid use has been used for cancer pain. And over the past 2 decades, we've seen an expansion of the use of opioids for acute pain and also chronic pain. Now, these are pain unrelated to cancer. This is great because obviously pain is a big issue in the society. However, and opioids do play a really important role in managing acute pain and also cancer pain. However, their role in managing chronic non-cancer pain or long-term pain is less well established.
So these are drugs that are prescribed, they are needed in many cases, but they can be abused by some patients, or in some cases were never needed by the person that actually ends up using them.
Correct, they can be abused, but in some cases it can be unintentional sort of long-term use, and that can be due to a lack of, I suppose, review of that patient's medication and also their pain. So that's an issue that I suppose needs to be addressed, is that we need to actually see these patients and review them and also work out whether they might need other potential therapies, which may include exercise as well as non-opioid painkillers.
And it's timely research. It comes, of course, after the Australian Institute of Health and Welfare found that overdoses from prescription medicines have already overtaken road deaths and illicit drug overdose as a cause of death in this country. Do opioids feature largely in that?
Yes, actually that report released recently showed that opioid deaths accounted for 62% of all drug-induced deaths.
And so use is on the rise, and we can actually look to the US to see where this can lead.
Yes, so unfortunately, obviously, we don't want to go down the path that the US is. However, we are seeing similar prescribing patterns as what we've seen in the US. I think one of the main things that we need to think about is that we need to think about raising public awareness about opioid use and ensure that people are on it appropriately, and also getting reviewed in a timely manner if they have been on opioids long term.
So that would involve healthcare professionals?
Correct, healthcare professionals, so seeing their GPs, their pharmacists, and any chronic pain specialists that they may be engaged with.
And what's your next step in terms of what you'll be researching?
So at the moment, we know obviously the opioid use has increased over time. What we want to look at next is whether the dosing that people are actually using, so whether they're using high doses of opioids, which have been previously linked to overdose risk. So we want to see what's actually happening in the Australian population in terms of what doses are they using and being prescribed.
Samantha Lalich, Austin health pharmacist and PhD candidate at the Centre for Medicine Use and Safety. Thank you.
Thank you.